Good evening, and thank you for being here. Welcome to those of you here at the Newmarket Bowls Club, and welcome to those who are following us via live streaming off-site. Initial estimates are that we have about 350 people attending between here and the 51 sites to which we're streaming tonight, which I think is not a bad effort for about 5 days of organisation. My name's Tim Smith. I'm a urology registrar based here in Queensland. I've been asked to speak this evening on behalf of a group called Junior Doctors Queensland. We're a group which has been formed recently by junior doctors who have been watching the evolving contract dispute and have been becoming increasingly concerned about how it's likely to impact our training and the care that we provide to our patients. I need to state up front that we're not affiliated with the AMA or the Doctors Unions ASMOV or Together, but we have spoken with them at length in formulating the discussions for this evening's meeting. We've also spoken extensively to reps from hospital sites, health districts around Queensland and from individual craft groups. I'd like to acknowledge the dozens of people who have helped put this evening together. Many of you are in the room tonight and you know who you are. I'd specifically like to make mention of Libby Anderson, who is a Brisbane-based orthopaedic trainee, and Gemma Robertson, who is a Townsville-based microbiology registrar, for the amazing amount of work that they've put into making this happen here and off-site tonight. I need to start with a disclaimer, and that is that I'm not speaking as a representative of Queensland Health this evening. I'm not speaking as a representative of my health service or my hospital. As stated in the Queensland Code of Conduct, it is our right to contribute to the public discourse on community and social issues in a private capacity. I am speaking tonight in a private capacity as a member of the AMA and the ASMOV Union, although not an elected representative in either of those groups. We'll move on to the agenda for tonight's discussion. Essentially, the express aims of this meeting tonight are to bring everyone up to speed on what's happening with the contract issues and especially focus on how this may possibly affect junior medical officers. I'd like us to vote on some broad resolutions so that we can come to a consensus position representing JMOs and those resolutions I understand have been circulated by paper in the room here tonight and also at our remote sites. If you've got one of those and you've had a read and could pass them around, that would be great. And then finally, we'll be discussing strategies that we can take to support our senior colleagues and make our concerns known. There are lots of details in the contract dispute. We'll be covering some of the detail tonight. It's essentially the amount of detail which we think you need to be able to understand and advocate on the issue in an informed manner. I apologise if this is something that you already know. We're essentially assuming a very basic level of assumed knowledge. We've made every effort to make sure that the information provided tonight is factually accurate. If there are any errors, we will correct them in due course. We're going to run to a very tight time frame tonight. We're going to try and get this done within an hour because we know that you all have places to be. For that reason, you'll only be hearing from me and from Tom Arthur, who is the chair of the AMA Council of Residents and Registrars this evening. Similarly, I'd ask you to keep your questions to the end, and essentially, if it gets to question time and you need to go, then that's very understandable. We have representatives from the craft groups here this evening, from the AMA, from unions. We have senior doctor representatives, and certainly when it comes to questions, we will call on them if there's anything that we're unable to answer. Firstly, a little bit of housekeeping. If you can all pull out your phones at some stage during tonight's meeting and go to www.qldjuniordoctors.com, you'll notice that it's a fairly primordial website at this stage, but it enables you to register your attendance at tonight's meeting. It will also sign you up for communication from our group. We recognise that the email streams that are coming out at the moment are pretty overwhelming. What we would like to do would be to discuss with the AMA, the unions and the hospital and craft group representatives about consolidating the stream of communication that's going to junior medical officers, and that may well happen in due course. Please understand that we will use your contact details judiciously and we will not pass them on to third parties, and you will be able to unsubscribe at any time if you want to. You can also follow us on Twitter tonight. The hashtag is QLDJRDRS And people will be live tweeting the meeting from the Twitter handles at Gematron and at Pineapple Reggies. If we have any technical issues with the live stream, essentially we're just going to try and continue the meeting here. There will be a summary of the meeting distributed at the end of the night, and hopefully there will be a video available as well. And we've incurred a few very small costs in putting this event on tonight. As I said, we don't have any affiliations. If you feel like helping out and could drop a gold coin in the bucket at the front door, that would be most appreciated. It will cover costs, and any surplus will go to the Keep Our Doctors campaign. So essentially, I wanted to start by talking about what are the issues with the senior doctor contracts. We're going to start by talking about how the contracts themselves came to be and what the issues are that the senior doctor representatives have with them. So firstly, the justification for the contracts. The government's publicly stated that there are a number of reasons for moving senior doctors off the collectively bargained award and onto individual contracts. In February of 2013, they released a blueprint for better healthcare in Queensland, and that stated, and I quote, in Parliament in July of 2013, it concluded that it's widely acknowledged that the right of private practice provisions were introduced as an incentive to recruit and retain SMOs, and that is an objective which seems to have been successful. There was a secondary objective of the scheme, which essentially was designed to offset costs by raising revenue from private patients being treated in the public hospital system. From this point of view, the scheme was a massive failure. It cost $804 million over 10 years, but it must be stated that that is due to maladministration at the Queensland health level, and it is not directly affected by the behaviour of doctors. The second Auditor General report into SMO conduct was tabled in February of this year. Essentially, that report involved looking specifically at 88 SMOs who were suspected of behaving inappropriately with respect to the right of private practice provisions. And they selectively audited that group. Of that, 7 were allegedly found to have not been attending work during rostered hours, and 8 were allegedly found to be improperly billing. Now, of course, I think we can acknowledge that that is entirely inappropriate and it's unacceptable. However, the senior doctor workforce is nearly 3,000 strong, so it's clear that those doing the wrong thing are in the minority. Many people believe that using the excuse of cost blowouts because of a maladministered scheme and citing small minorities of senior doctors doing the wrong thing to justify sweeping changes to senior doctors' industrial conditions is fairly disingenuous. Certainly that's the message coming from the organisations representing senior doctors. Just to touch base on how the contracts have been implemented, the process began in August of 2013, where meetings were initiated between the government and senior doctor representatives. We need to say that there's significant disagreement about how truly representative these discussions were. The government has published a list of 33 meetings which took place between August and January, including those who attended, and it must be said that the attendance at those meetings was enormously variable. Certainly it's hard to see if we were allowed to consistently represent ourselves. The government similarly cannot provide minutes of those meetings to outline what discussions took place. Senior doctor representatives have stated that the government largely ignored the concerns that were raised in the course of those meetings and unilaterally ended the discussion in January. To understand the concerns with the contract specifically, you also need to understand that there are in fact several documents which will govern the employment of SMOs from this point forward. Consultation meetings finished, and we understand that the contract has been left largely unchanged since then. The Industrial Relations Act 1999 and the Health and Hospitals Board Act 2011 were amended in a session of Parliament in December of 2013. In the IR Act, the Industrial Relations Act, that is, Section 73(1)A, which states that the dismissal is unfair if it's harsh, unjust, or unreasonable, was changed so that that specific phrase does not apply to senior doctors who sign this contract. In the Health and Hospitals Board Act, section 51C3, the state introduced a new clause which essentially said that the Health Employment Directive prevails over the contract, and the Health Employment Directive can be issued by the Governor-General, by the Director-General, which essentially is the clause which enables these contracts to be unilaterally changed. Now, after further meetings with doctor representatives which took place in March, the government issued a contract addendum which purported to address some of these issues, and they agreed to partially reverse changes to the Health and Hospitals Board Act, although the proposed changes would still allow that the contract could be overruled by a Health Employment Directive if a regulation provides otherwise. And essentially a regulation can be issued by Cabinet, it doesn't have to go to the floor of Parliament. At last Wednesday's Pineapple meeting, the proposed changes were unanimously rejected by a resolution of the meeting, and essentially that's the current state of play where we find ourselves at the moment. The deadline for senior doctors to sign the contract is April 30, after which, if they choose not to sign, they will continue on the award, but for a short period, but they'll lose access to the right of private practice incentive scheme, which for option A doctors is about 30% of their salary. Senior doctors and their representatives, as you're well aware, have a number of concerns with the contracts. Let me first and emphatically state that money is not one of these concerns. The majority of SMOs will be on fairly similar remuneration in the first instance. Remuneration will go on to be tied to key performance indicators through a series of tiers of remuneration, and these KPIs may well be able to be unilaterally changed down the track by the health service, but the government has put that on hold for a period of time, and so right now remuneration is not what senior doctors are principally concerned about. What they are concerned about is that the contract allows for unilateral changes to their rostering and fatigue provisions, to their key performance indicators down the line, and to their place of work, and essentially that includes the ability for them to be moved anywhere within the health service district. The contract addendum, which was supposed to address these concerns, still states that a senior doctor cannot unreasonably refuse rostering and transfer changes, which is obviously still a concern that senior doctors have. Their second point of concern is that access to the Queensland Industrial Relations Commission for dispute resolution and unfair dismissal has been unilaterally removed. In place of this, if a dispute occurs, the Director-General can request that a Deputy Commissioner of the QIRC reviews this decision, but obviously this isn't the same as accessing the QIRC itself. The collective effect of these provisions is essentially, senior doctor representatives are telling us, that health services will be given unilateral powers over their employment, which may well jeopardise their clinical autonomy, and I guess that is most likely to relate to decisions about patient care which will financially impact on the health service. The legal opinion commissioned by the AMA from Senior Counsel Dan O'Gorman concluded, and I quote, that this contract is a draconian contract of employment, end quote. The legal opinion from senior doctor representatives have concluded that the contract addendum and the proposed changes to the Health and Hospitals Board do not offer adequate protections against unilateral changes to the terms of employment. Some senior doctors have indicated, as you well know, that because of the introduction of what they consider to be unfair employment contracts, they're planning to resign from Queensland Health. Mass resignation strategies, as you know, have been proposed, with potential dates for submission being March 31st and April 30th. So essentially that's the background to the contract dispute, which I understand is fairly dry, but that's an abbreviated version of why senior doctors are so concerned about these contracts. I'd like to move on to talk now about the potential impact that the contract can have on junior doctors. Some of this discussion is going to relate exclusively to trainees and training positions, and I apologise for that. We acknowledge that there are significant implications on pre-vocational trainees as well. Firstly, we'll discuss the potential impacts if large numbers of doctors, or senior doctors, do resign from Queensland Health because of the contract dispute. Clearly this is going to impact us in terms of the number of supervisors that we have available in our clinical environments. If this drops below the requirements of the training colleges or the CPMEC, which is the Confederation of Postgraduate Medical Education Councils, which accredits the intern and resident training, then that's certainly going to be a problem. The potential is that junior doctors will be left inadequately supervised, and that may compromise the quality of care which is provided to our patients, and it may in addition diminish our training positions and in fact see them become unaccredited. We've spoken with training representatives and in some cases the colleges directly, and the information that we're getting at this stage from the colleges is that they will not alter their accreditation standards. So essentially it stands to reason that if a training post falls below the accreditation standards, then the potential outcomes can only be one of two things. One, trainees will be moved to another training post, which could potentially be in another state, or two, trainees will have to serve periods in their training which will be unaccredited. In addition, we've been told that some colleges are actively considering not accepting training intakes for 2015 in Queensland because of the uncertainty about training positions. Trainee reps have provided us with details of their college's supervision requirements, which we've displayed up here. This is a two-page slide, so have a quick glance if your college is represented up there. Essentially, this outlines the supervision requirements for accredited training jobs under these specialties. If you take some time to have a look, you might want to consider how your service would fare if 1, 2, 3 or more senior doctors resign from their public posts in your training job, in your training position. This information will be distributed online at the conclusion of the meeting. We'll move on now to discuss the potential impacts if the contracts are signed by our senior colleagues. Firstly, as we've already gone through, the contracts give the health service the ability to change your supervisor's rostered hours, which has been speculated in some specialties may include replacing registrars on on-call night with consultants doing on-call nights. In addition, the contracts will allow health services to move your supervisors anywhere within the health and hospital service. The potential impacts on training are obviously far-reaching, but they're not entirely clear at this stage. Secondly, we feel that the contracts don't adequately enshrine protected clinical support time for senior doctors to teach and supervise junior doctors. As stated in the blueprint for Queensland Health that I spoke about earlier, one of the rationales behind the introduction of contracts is to improve the productivity of the medical workforce. A senior doctor who signs a contract will be given KPIs, and some of those KPIs may well relate to productivity dividends. If they are in a health service which is under pressure to reduce waiting times, they may well have that health service put pressure on them, compelling them to forgo teaching opportunities in order to prioritise service provision. Finally, it obviously goes without saying that if these contracts become the standard employment agreement for senior doctors in Queensland Health, then we will be required to sign them ourselves if we wish to work publicly in Queensland when we become senior doctors in the future.
Sorry to interrupt. Can't hear anymore. It stopped working.
It stopped working, or is that better? No. How long has that been going on for?
Just talk loud.
Okay, so I want to move on to discuss.
You better be more about it.
How long has that been going on for? Do I need to repeat anything? So I want to move on to discuss the contingencies which are being talked about in the event of mass resignations. We've approached the government about this issue and we've explained our concerns in terms of the potential impacts on training and supervision. The response has been so far, and I quote, "There are contingencies and training will remain a priority." They've not elaborated beyond this, and I think we can all agree that this is unsatisfactory. With respect to contingencies which are coming from the colleges themselves, we understand that colleges are actively considering this issue and taking it very, very seriously. The information that we have from speaking discreetly with some of the colleges and the representatives is that they feel contingency plans cannot be fleshed out until they know the scale of the potential resignations. The colleges have also been advocating directly to the government regarding supervision and training issues. The Council of Presidents of Medical Colleges, or CPMC, which you might have heard of, issued a position statement saying that they would, and I quote, "view with concern any reduction in senior medical staff numbers Letters of concern have gone directly to the government from the College of Pathologists, Dermatologists, anaesthetists and surgeons that we know of, and possibly other colleges that we're unaware of. Representatives from the colleges and specialty societies met with Minister Springborg within the last 24 hours, although the outcomes of those discussions are not yet public. We understand that there is an issue in terms of communication between the colleges and trainees. It's been raised with us on a number of occasions. It would seem that the most appropriate action in that respect is that elected trainee representatives contact the colleges directly and ask them to communicate with their respective trainees. So essentially, we hope that that provides enough background into the issues with the proposed senior doctor contracts and the potential impacts that it can have on junior doctors. You'll notice that, unfortunately, there's not much in terms of solutions in that discussion, and that's simply because the government is taking a pretty hard line and not really coming to the table with any proposed solutions, which is why we want to take away from this meeting some resolutions which essentially will be broad consensus statements from junior doctors. In the interest of time and brevity, we won't open the floor to debate about these resolutions. We'll simply be asking for a vote in favour, against or an abstention. All opposed? Any abstentions? One abstention noted. Queensland junior doctors call on the Queensland Government and senior doctor representatives to recommence negotiations on the term of the proposed senior doctor contracts. All in favour? All opposed? Any abstentions? Supervision by senior doctors is required to ensure patient safety and accreditation of training. Queensland junior doctors assert that we will not work in environments without adequate supervision from senior doctors. All in favour? All opposed? Any abstentions? 2.
There's a lag on the live streaming, so I'll let you know as soon as I get the numbers.
All right, we'll wait for the off-site tallies and we'll let you know shortly. So we'll move on to the end of this discussion, which is essentially what junior doctors who want to advocate on this issue can do. I get the feeling from the room that there is a good deal of support for our senior colleagues in their fight against these contracts. Having said that, we feel very strongly that the issue that we have to take with these contracts as junior doctors is about the implications on training. We have a fairly unique opportunity for all junior doctors to extol the same message in terms of what we're going out there and saying. And essentially, we feel that this message should be that if senior doctors leave the public hospital system because of the contracts that they feel compromise patient care, we will lose our supervisors. Junior doctors need supervision by senior doctors to ensure patient safety and to provide the training required to become the next generation of senior doctors looking after Queenslanders. Now, this isn't something that has to be taken verbatim, but it's essentially the message which we would strongly suggest that junior doctors are putting out there. In fact, we'd so strongly suggest it that if you feel so inclined, take out your phones and take a photo of that page, because that's what we'd like you to go home and advocate on. In terms of any communication strategy, it has to be geared towards maintaining the support that we have from the public and winning more public support, because at this stage it seems like that is the only way that this government is going to be turned around on the issue. We very, very strongly feel that the best way to do this is with polite, dispassionate explanation of the facts, which is why we've spent so long this evening on what is fairly dry points of discussion. We realise very strongly that people are passionate about these issues, and obviously that comes from the passion which we hold for our jobs and which we hold for the health of our patients. But at the end of the day, getting involved in a public shouting match is going to be counterproductive to our message, and in some cases it may well be unprofessional. So how do we get this message out there? Social media is one of our most powerful tools. I know some people think it's oversold, but I genuinely don't think that's the case. There is an enormous role for going out and contacting people on Facebook, commenting on online news articles, which you might have noticed come thick and fast from some local publications, and even getting onto Twitter. At Dr. Contracts Facts is the Twitter handle that Lawrence Springborg is using at the moment. Hashtag Dr. Contract Facts is the hashtag that some people are using to correct those facts. Hashtag Keep Our Doctors is being widely used, and hashtag QLDPOL is subscribed to by most political reporters in the state. Having said that, the sound of furious agreement on Facebook, while it might sound reassuring, isn't actually getting our message out there. What we need to be doing is taking this message to people who don't know the facts or who in fact disagree with us, possibly because they're misinformed about the facts. On a similar line, we would suggest that you go out there, in fact we would implore that you go out there and contact your friends and family and tell them about the issue at hand. More specifically, you need to ask them to write to their local Member of Parliament and to the Health Minister and Premier. Public correspondence from members of their electorate has much more powerful impact than conjointly signed letters or even individual letters coming from within the profession. Another strategy which you might like to consider, and which has actually been quite widely used by the senior doctors, are letterbox drops to your neighbourhood. Most senior doctors have been using the strategy of personal letters, providing their neighbours with details about these contracts, why they are concerned about them, and obviously bringing it back to the message that we spoke about, which is that this will affect our supervision and will therefore affect patient care, our training and the delivery of doctors to Queensland in the future. Finally, we touched on letter writing to MPs and ministers. If you haven't done it yet, it's worthwhile doing, but keep in mind that they're getting a lot of letters from the profession, and many of us get the impression that we're being sidelined in that respect. This is a very, very important point that we need to make about the Code of Conduct. The Queensland Health Code of Conduct makes note of public comment by public sector employees, and it says that commenting on government policy is a matter for ministers, not employees. Unless prior authorisation has been given, we will not comment to the media on government policy. Like any other citizen, we have the right to contribute to public discussions on community and social issues in our private capacity. In doing so, we will take reasonable steps to ensure that any comment we make will be understood as representing our personal views, not those of the government. If we are elected workplace representatives or officials of a trade union or professional association, we are not required to seek permission from our workplace before speaking publicly in that capacity, and we will make it clear that our comments are not made on behalf, are made on behalf of that organisation. In addition, we've received some advice that if you identify as a union member, which may or may not include the AMA, when making a public comment, you may have additional protections under the Freedom of Association provisions within Chapter 4 of the Industrial Relations Act and under the Anti-Discrimination Act of 1991. That's all fairly wordy, and I'm not sure that I fully understand it myself. I think the take-home message has to be that these provisions apply to any public comment, possibly including social media comment. Do not speak on behalf of Queensland Health or your hospital. That's fairly obvious, but the advice that we've received is that you should not go out there and say, my name is Tim Smith and I work at such and such a hospital. Do not make any public comments under any circumstances attacking individuals, which includes the Minister, the Premier, the Director General, Des Houghton. Essentially, that's playing you want to play the ball and not the game. That's not our argument. We need to get out there and put out our argument. Our argument isn't against these individuals. It's not going to help our cause if you go out and slander them, and it may well be regarded as unprofessional by your employer and possibly even our accrediting body, APRA. If you choose to talk to the media, you have to get representation before doing so, and you need to seek a legal opinion about what you are going to say. And as we've said, and I'll reiterate, it's not established yet how these provisions pertain to social media, but there is a strong argument that can be made that they do. There are a number of resources which you can go home and look up, and if you plan to go out and publicly advocate on this issue, keepourdoctors.com.au is an excellent central repository. Our website, qlddjuniordoctors.com, hopefully by the end of the weekend we'll have a resources link with essentially links to everything that we've discussed this evening, as well as things like sample letters and sample comment. In addition, we would strongly encourage you to consider joining one of the representative organisations, AMA or the unions, ASMOF or Together, especially if you plan on making public comment about this in any forum. I'm going to hand over now to Tom Arthur, who's the Chair of the Council of Residents and Registrars from the AMA, and ask him to briefly update us about what the AMA is doing in this respect, and then we'll return for some questions.
Tim, do you want to send resolutions?
Quickly.
Yeah, so. Towns and Cairns.
With respect to the resolutions, we've got off-site groups of 25 in Townsville, 36 in Cairns, 30 in Rocky and 8 in Nambour, as well as individuals online who haven't been counted. There was unanimous agreement for all 4 resolutions from the off-site meetings, which essentially means near unanimous resolution for all 4 resolutions passed this evening.
Thank you, Tim, for the opportunity to speak tonight, and thank you to the organisers of this evening who've done a remarkable job to pull this together in such a short amount of time, and I think we should all show our thanks to them. So as you've heard so eloquently from Tim tonight already, there are dark times ahead for trainees in Queensland. If these contracts are introduced, many of our senior doctors will resign. Any significant number of resignations of senior doctors out of the public health system in Queensland will have damaging consequences for the immediate and future training of doctors in this state. Now, I want to advise the meeting tonight that the AMA is working with our Queensland trainee representatives, trying to work on a united call of concern in regards to the damaging consequences that these contracts will have in this state. It's unusual for the colleges to come together. As Tim has already mentioned, federally, the Committee of the Presidents of the Medical Colleges have taken action in an unprecedented communication to a state government that they are concerned about the future of training in this state. A strong consensus statement at a local level will be necessary to our cause and will be a significant step. A letter will be coming out in the coming days. I ask you to take a read of it and pass it on to the powers that be in your local health and hospital service. Further, I'd like to advise that today I was discussing our issues with Dr. Alex Douglas, who is a former general practitioner, who is the current Member of Parliament for Gavin. From this discussion, Dr. Douglas is willing to sponsor a formal petition to Parliament to bring the House's attention to the damaging effect that these contracts will have on trainee doctors in Queensland. Now, this will allow an opportunity to have our voices and our concerns raised on the chamber floor of Parliament. and I encourage all of you to get on board, and more details will come out in the next few days as well. This will affect all of us, from interns to residents to registrars to medical students. There are 4,745 doctors in training working in Queensland Health at the moment. We need to stand together in unison to make the government and the public aware that the sustainability of the medical workforce in Queensland will be irreparably damaged by the introduction of these contracts in their current form. Thank you.
So there's one more point that I wanted to touch on before we move on to questions, and that essentially is how junior doctors can communicate. I can't endorse Tom's comments enough that the most effective way we have of advocating on these issues is if we display a united front, which essentially means being able to keep junior doctor members up to date with what is happening. So I'd encourage you again to go to www.qldjuniordoctors.com and register that you're at the meeting tonight and for future correspondence. In addition, it would be useful if you put yourself forward as a hospital or craft group representative to our group or to the AMA, Council of Residents and Registrars. If that's something that you felt interested in doing, you can actually put a checkbox on the form on our website.
People knowing me and approaching me in coffee shops who I've never met before, and they go, "Oh, you're Suzanne Royal." It's like, yes, I know that. I am Suzanne Royal, and I'm a paediatrician at Prince Charles Hospital. I'm a staff specialist. I was going to put in my application for a senior staff specialist, but I don't know whether there is much point at the moment in view of the other paperwork that's being bandied around at the moment. But I've been part of the negotiation team for the contract through December and January since the contract was released more publicly in November after the earlier meetings that the DG and the Minister have been talking about, and I've also been part of the negotiations with the DG and Health Minister in the last week or two. I've also been a little bit in the media and been sticking my head above the parapet, and I'm more than aware of the Code of Conduct because I've taken the legal advice that is so important before you do that. A few things that have been put forward to me though through the people that I've been speaking to throughout this campaign that I think are useful in terms of the things that you can do in terms of raising awareness with your MPs, with your communities, though I just wanted to bring to your attention, you think that you are only a small person in this whole campaign, but you're actually part of a really important machine, and being a small part of a bigger collective group is a really, really powerful role. And so if you just write one letter to your MP or arrange to make an appointment with your MP and go and talk to them about this issue, that makes an impression. And the things that have made a really big impression with the MPs, and I've had this feedback from various politicians that I've now got the misfortune or otherwise to have their numbers in my phone, have been that the stories that make a difference are the personal stories. So no mass pro forma letters and no things that get into the media as being accused of being written by union officials, which for the record is not true. The letters that have been going into the letterbox drops have been written by the doctors themselves. So the letters that you write for your letterbox drop should be written by you. The letters that you write to your MP should be written by you. It should be your story. If you're a urology trainee or a paediatric trainee or an intensive care trainee or someone who's on maternity leave who's worrying about where their next job's going to be, or thinking about uprooting your family and moving to New South Wales because you're worried about whether or not there's going to be a radiologist or not in your department next week, and whether or not there is going to be in fact a training position for you, you should tell that to your MP and to your community and make them aware of this problem, because those are the personal stories that really make a difference. So the bigger issue about the 5 drop-dead issues or the over my dead body issues, whatever you see in the front page of the Courier Mail this morning, that's not really all that important. What's really important is your story. And if they get 100 personal stories, that makes a very big impression. And I think that the small role that you have to play becomes a much bigger role in that. And that's really what I wanted to say. I think it is important to fight with politics and not the person. I did want to say that emotions are running very high at the moment, and people do say things about individuals. I've said a few things about individuals on my Facebook page that maybe do breach the code of conduct. I might stop that now. The other thing I did want to mention that hasn't actually come up at all tonight is that the whole issue about this contract is that the Health Minister is on the record as saying that senior doctors are just the first cabs off the rank. And there's been a whole lot in the media about how we're all very highly paid professionals and how this is very standard to be on a contract. Well, I can tell you that it's not very standard to have a contract that can be unilaterally amended, where unfair employment provisions have been taken away, and there's all sorts of things in this contract that are not at all standard in employment contracts, and we've had very good advice to suggest that from a number of lawyers now. And the unfettered management prerogative that is in this contract is certainly unusual. But all of that aside, if this gets up for senior doctors, other highly paid professionals, whether they be senior nurses or senior public servants, will also be put on similar contracts. And it also paves the way, as you will see in the coming weeks, for other groups to have their conditions and terms taken away from them, and that includes award stripping. And so you will have seen some of that in the last little while with our allied health colleagues, and that is coming your way, my friends. So award stripping will come your way, and it will be coming your way very soon. So the modus operandi of this government in the way that they have treated their senior doctors is what they intend for everybody, and it's what they intend for you, and it's what they intend for you in the very near future. So becoming engaged and becoming involved now and becoming unified now. And I know that some of you may have had some level of discomfort about the presence of union officials wearing T-shirts earlier this evening because you don't see yourself as part of that union machine. I can tell you there is no us and them when it comes to the union. The union is you. The union is you people standing here or sitting here in this room, all standing here or sitting here united and coming together because you have a significant level of concern about this problem. Unity is strength. And whether that is a whole group of doctors sitting together in a room or whether it happens to be a person wearing a T-shirt and wearing the brand of union official, that's fine. I'm here because I'm an SMO. I also happen to be a union delegate now. Someone gave me that title some time ago, but you know, I'm a union official. Actually, I'm wearing black leather. Maybe that is part of it. But anyway, I'm also an SMO. I'm a doctor holding a pineapple. So are you. That's what unions are. Yeah, that's.
Before we finish up, does anyone have specific questions from the floor that we might be able to answer? Yep. So just for the remote sites, the question was, can we formulate a single message? And essentially the answer to that is, firstly, the resolutions that have been put out tonight will be widely distributed and available for you to put into your personal correspondence. They will also be included in letters which go to ministers and various departmental representatives. I would endorse the comments that a few people have mentioned tonight, which essentially is that the more personal you make your story, the better. And so what we're strongly advocating is that the take-home message, which we put up here, is what you're saying, but that you're saying it in your own words. And I would hope that that goes some of the way to doing that. If you feel there's another way to do that, then I'd be very happy to address that. We can have a chat at the end of the meeting. Any further questions? Thanks very much for your time tonight. I appreciate it was a bit dry to sit through, and I really appreciate it.